So what can you do to increase your sex drive? No shame here, let's talk about your options. I'm Dr. Kaplan, founder of DrWell, a wellness company. If you're female and you have decreased libido, then you have a few options. First, after an evaluation by your provider and lab work, then you can make some decisions on different hormonal therapies. Based on your lab results, you may need to supplement your progesterone. Progesterone comes in forms such as creams, capsules, or even troches, which you can think of as lozenges. Progesterone is a naturally occurring hormone that's used in menstrual cycle regulation, fertility, and balancing estrogen levels. Keep in mind, this is a relatively easy fix that does not require injections. While progesterone is often used in perimenopausal women, then there's estradiol that's most often used in menopausal women. And that's because estradiol can help with vaginal dryness, famously used by Samantha in Sex and the City.
I am leading the way through the menopause maze. She's the hormone whisperer.
One of the ways estradiol helps postmenopausal women is it treats vaginal dryness. And this is often associated with painful sex or dyspareunia. Under the guidance of your DrWell provider, both progesterone and estradiol may be a great treatment for your pre- or postmenopausal symptoms. Now let's talk about the men. Most men fall into two different categories, either low libido or they have erectile dysfunction. And after being evaluated by a provider and getting lab work, there may be three possible treatments for that. Number one is testosterone injections, which is typically weekly. But if people don't want to take injections every week, then the other option is Kaisertrix, which is actually testosterone in an oral version. And the only downside to that is it's a twice daily pill. And then the downside of both testosterone and Kaisertrix is because it's exogenous testosterone, it actually can reduce sperm production. So if you're interested in fertility, then that might be an issue if you have a decreased sperm count from that exogenous testosterone. So the third option to minimize fertility issues is a medication, a pill called enclomiphene. And this is a different category of medication, which is actually a selective estrogen receptor modulator. Through a complex feedback mechanism, enclomiphene increases the production of testosterone. It does not increase estrogen, which reduces the likelihood that you'll develop male breast tissue. And because enclomiphene also increases testosterone, it does not reduce fertility or sperm production. So decreased sexual function is nothing to be embarrassed about. Reach out to a DrWell provider and we can evaluate you and see if you're appropriate for any one of these treatments. Questions? Ask away in the comments section below.